A 5-minute neck scan could help to spot people at risk of dementia before symptoms appear. A group of international scientists examined blood vessels in the neck and found those with more intense pulses went on to experience greater cognitive decline. We can talk to Dr. Karen JUTLLA, Dementia Lead for the School of Nursing and Midwifery at De Montfort University in Leicester. Welcome. Thank you very much for joining us. So the idea is that those with a more intense pulse in the vessels in their neck can end up having structural changes in the brain's blood vessel network, minor bleeds, and the structure of the vessels in the brain can be damaged as well. Is that because of basically high blood pressure?
Yeah, I think what the study is highlighting is that having vascular symptoms can increase your chances of obviously developing a cognitive decline. And the first stage before you actually have all of those problems that you've just highlighted is blood supply. So that could be low blood pressure, high blood pressure, anything that affects your blood supply to the actual brain.
And is this something that has been known anyway for a long time, or is it telling us something new?
Absolutely, yes. I think we've got to be really careful. We're not saying that the 5-minute scan will say that if you've got an intense pulse rate, you are likely to get dementia, because that might scare people. Actually, what it's saying is you're more at risk at developing vascular problems, which increase your chances of developing dementia. And it's highlighted that actually vascular problems can cause dementia because of the increased cognitive decline. It's not saying you will definitely develop a dementia, and I think we need to be really, really clear about that.
So it's high and low blood pressure?
Yes, it's anything that affects blood supply to the actual brain, which is why if anything we can take from this new study, the scan, is the importance of exercising, eating healthy, drinking plenty of fluids. Anything that encourages that blood supply to the actual brain will lower the risk factors for developing mini strokes in the brain, anything that can cause a decline in the brain's functionality, because that's essentially what dementia is and what it is caused by. Yeah.
So I mean, I guess what people listening who, everybody obviously will feel some level of concern about dementia, whether it's in family members or themselves, because it is such a prevalent thing, and so many of us obviously have experienced it up close. Is the message basically, if you have high or low blood pressure, you need to do something early to deal with it and prevent potentially dementia? I mean, could it prevent dementia if you address the blood pressure issues?
Absolutely, and I think this study's gone one step further than that as well, and said actually if you're somebody who has an intense pulse rate, you are someone who potentially could develop later on maybe blood supply issues like low or high blood pressure, and you need to be someone more mindful than anyone else. But the message goes out to everybody. Interestingly, I know from my own research that vascular dementia is very common in Black, Asian and minority ethnic communities in the UK. It's the most commonly diagnosed type of dementia, and it's because of vascular risk factors associated with diet, hypertension, diabetes. So what this is doing is really raising awareness, and it's proved essentially, even if only in 50% of people, that if you have any type of blood-related issue to the actual brain, you need to go that extra mile to look after yourself a bit more. Alternatively, if you're someone who doesn't have blood pressure problems or might not be susceptible to them, that doesn't mean that you shouldn't maintain that healthy lifestyle anyway, and that you might not develop it later on in life. So it's about using this research to really raise awareness about the risk factors associated with dementia, and that we need to look after ourselves physically.
Dr. Karen JUTLLA, thank you.
Thank you.